The procedure room is designed from scratch to allow us to perform smaller surgeries, lower risk surgeries right in our clinic. There are some technical differences between this procedure room and a true operating room, such as we have sinks in the room and an operating room does not. And the kind of ceiling that we have is updated for a procedure room, but it's not exactly the kind of ceiling that you have in an operating room. We don't have positive pressure air flow. We have regular negative pressure airflow. So those are the technical differences. But what's important is that we actually have all the capabilities of the operating room for those lower risk procedures. We have cautery, we have a CO2 laser, we have smoke evacuator, we have sutures, we have a surgery chair. Flooring is operating room grade. The counters are operating room grade. We have an autoclave. We have a very extensive set of surgical instrumentation that we can use. And this gives us the ability to offer patients a different experience. There are three reasons why a patient might choose to have surgery in our in-clinic procedure. Number one, the timing is convenient for them. When we are available in the procedure room is what's best for their schedule. A second reason, a very common reason why people seek out surgery in the procedure room is because it is less medicalized. So they can have a light breakfast that morning. They don't have to be NPO. They don't get an IV. They don't have to change into a gown. They don't need to be monitored for an hour afterward because they don't have anesthesia. It is less medicalized. There's no IV to remove, etc. The third reason that patients choose to have surgery in the procedure room is cost. For patients who are self-pay, for example, for cosmetic surgery, they save a very significant amount of money on anesthesia and facility fees if they have the surgery in our procedure room, because there is no anesthesiologist to pay. And the facility fee, I bundle it into everything else that I'm doing. It's just part of my overhead. I don't charge them extra for it. In the hospital, that's part of the deal. You have an anesthesiologist, you have a nursing staff, you NP off to midnight, you're changing into the hospital gown or the surgery center's gown. You need to comply with their policies. You need to be there an hour and a half in advance. You need to be watched until you're ready to, any which way we watch you always. But it's more medicalized. You get an IV, and there is a cost of anesthesia and facility. If you are self-pay for a cosmetic procedure, for example, it saves you thousands of dollars. And maybe the surgery in the procedure room is a little bit more uncomfortable because you can feel a little more, such as the injection. You feel the injection of the numbing drug. Overall, the thousands of dollars you save make it worth your while. The other issue of cost is that most patients today have significant out-of-pocket costs, even for a covered procedure. So they have not only deductibles, but they have copays and coinsurance costs. And the surgery in a procedure room, because it's a lot less expensive to the insurance company, the insurance companies want to incentivize patients choosing this option. So they might reduce or even waive the coinsurance payment that is charged directly to the patient. So whether the surgery is functional or cosmetic, there oftentimes are financial incentives for having surgery in a procedure room rather than in a surgery center or in a hospital. So those are the three general reasons. It is more convenient time-wise, scheduling-wise. It is less medicalized, and it is less costly. Now, those are three good reasons to have surgery in the procedure room, but the key question is, do you get the same quality? And the answer is unequivocally yes. In the 2 years that we have been using the procedure room, we have not had any infections, not a single one. We follow sterile technique, just like in the operating room. All our instrumentation is cleaned and sterilized, just like in an operating room. Actually, in some ways better, because it is my team, my staff, that cleans and autoclaves the instruments. So they have a vested interest in all of it. They are not part of some big hospital department for sterile processing, which oftentimes employs people who don't necessarily know our instruments. And because in ophthalmology and oculoplastic surgery, we use micro instruments, you could imagine that the instruments could get damaged if they're not handled properly. So that really doesn't happen for us. If it does, it costs me a lot of money to replace or repair the instruments. And so I would know about it. So it's not just a low infection rate. We've had no infections with hundreds and hundreds of surgeries done.